there, my name's Dr Anisha Patel. I'm a GP in West Sussex and I'm also a stage 3B rectal cancer survivor, having finished treatment in March 2019. Since the advent of COVID, general practice has really evolved and we're not really seeing as many patients as we would be face-to-face in consultations, and we really have changed to more telephone consultations, video consultations and e-consultations. We've noticed as GPs that we have at points during this crisis been seeing less people, and we understand that our patients have been worried about the coronavirus pandemic. They're worried about burdening the NHS and their doctors, and they're actually questioning the safety of their general practice or their surgery. So what I'd like to do today is actually give you a virtual tour of the practice that I work in here, to show you some of the safety measures that we've put in place in line with government guidance and safe social distancing. Obviously different practices will have taken similar measures but not necessarily identical measures, because factors such as building layout etc. will affect this. So I'm going to pretend to be the patient today and going in to check in for my appointment because the doctor's deemed that after the telephone consult I need to actually have a physical examination. So if you follow me. So we have hand sanitizer here, so we will ask all of our patients to wear hand sanitizer, and ideally all patients should be wearing a face covering when they enter the building. If we come into here, there's footprints on the floor and there's a safe social distance measure between the receptionists and the patients. We've actually ordered a large perspex screen to shield between the patients and the receptionists, again to enhance safety measures. Obviously we have a sign here to ensure that patients wear a face cover, and obviously I see our lovely receptionist here is donned in a visor and a mask, and that's what you'll find in many practices. We are actually staggering a lot of our appointments as well so that we don't have full waiting rooms, and so as you see today our waiting room is quite empty, but if the receptionist has checked you in on the computer there, she'll ask you to either stand on one of these spots that have been socially distanced according to the government guidance at that time, or take a seat if necessary. If we turn around and walk through our door here, when your doctor or nurse calls you, we'll go to see our GP. And obviously they will look slightly different to when you've seen them prior. This is one of our doctors here, and as you'll see, he'll be wearing an apron, some gloves, possibly a visor and a face mask. So all of our doctors and nurses are asked to wear PPE when they're examining patients, and all the rooms are decontaminated before and after seeing a patient. Many surgeries, if they can, with their layout, will ask patients to come through one entrance, and then after I finish my consultation, I will exit out the door there, so there's no crossover between patients. I hope this video today reassures you and gives you clarity and confidence to return to see your GP with any persistent or worrying symptoms. For bowel cancer, for example, if you have persistent change in bowel habits, whether that be loose or more constipated, or blood from your bottom or in the stool, weight loss, lumps in your tummy, tiredness or tummy pain, it's imperative that you seek help from your GP. Bowel cancer is the second largest cancer killer in the UK, and we know that it's treatable and curable if diagnosed early. For further information, please visit the Bowel Cancer UK website. Thank you.